Taylor McPartland, CEO of ScaleHealth. So great to spend some time with you today. Welcome aboard, my friend.
Thanks for having me, Mike. Good to see you.
It's great to see you as well. Now, you hear a lot of elevator pitches from startups and CEOs and others. I'm going to put you on the spot. Give me the Taylor McPartland elevator pitch.
Absolutely. So, Taylor McPartland, I'm the CEO of ScaleHealth, and I am just passionate about working with entrepreneurs that are really trying to tackle very big systemic challenges. I figure that the entrepreneurial world, running a startup is hard enough, and then running a startup that's trying to tackle an industry like healthcare is even harder than that. And I want to do everything I can do to do the blocking and tackling so that those entrepreneurs who are dedicated and passionate enough to fix an industry like healthcare can focus on doing just that. And I want to help them eliminate the noise and the challenges so they can move this industry forward into the future.
So what are some of the important lessons or mindsets that the healthcare industry can be learning and apply from your previous world?
I think it's very similar. I think it's, the entrepreneurial mindset is so fascinating because all entrepreneurs, and I know you'd relate to this and, completely agree, but there's this sense of like, I know a better way to do this thing. Like the status quo is not working. I know a better way to do it, and I'm going to keep pounding the pavement, keep questioning, keep challenging, keep figuring out a better way to make it happen. And then if I get that light bulb, if I see that vision for what's possible, I'm just going to keep running my head into the brick wall until I'm able to make some headway. And so I think that mindset of let's really get critical about what's not working here. Like why are we not able to care for more patients? Why are we not able to care for all types of patients equally? Why do we have such discrepancies in terms of quality of care and of communications? And like there's the 50 million challenges along the way, and every one of those has an opportunity for innovation and for improvement. And if we can really put an entrepreneurial mindset into place there, where there's more of an interest and more of a framework around thinking critically and challenging the status quo and asking probing, challenging questions, I think we'll be in a much better place, and I think we'll be able to deliver better quality care nationally and globally.
Yeah, and I'm sure you're familiar with the famous Z-Dog MD. He's a physician turned healthcare rapper. His messages, though, are so profound, and I think building on what you just mentioned, Taylor, he talks about kissing the ring of orthodoxy and getting away from that, right? Oh, this is how it's always been done, so therefore we're going to keep doing that. And just like we mentioned earlier, we can no longer keep doing what we have been doing. We must change the game, and you're right. Entrepreneurs, I don't care what industry they're in, that's how they think. How can we do things differently? What are some unique angles we can come at this problem? I get so energized by the entrepreneurs that you get to work with at ScaleHealth. It's a phenomenal community. You also recently made a public comment that was incredibly important from my perspective. We already talked about a little bit around the pandemic and some of the things of we can't go back to what we have been doing. And what you recently mentioned publicly is that the healthcare industry cannot get complacent following the events of the past 18 to 24 months. What do you mean by that, Taylor, and how can we collectively combat it?
Yeah, I mean, I think that suddenly, maybe beginning in last March and through last summer, there was really awakening around all of the, all the social challenges, all the health challenges that we were facing as a society. And there was this quick opening of opportunity where suddenly everyone was looking into implementing telehealth and into implementing new innovative solutions into their health systems. And that's fantastic. And that's a lot of the mentality that we need to keep moving forward. But what I'm afraid of is a sense of complacency where, the larger established players are going to say, like, "Oh, we have telehealth now. We've implemented it. We've got great usage. We can use that as an incremental step forward, but now we're good. Now we're just going to kind of sit pat here, and we don't need to be continuing to push the boundary on health and healthcare and care in general the same way that we were over the past year." And I hope that doesn't happen, because telehealth is certainly a solution, but it is not the solution. It's a solution to a big problem, but as we've been talking about, there's a lot of big problems out there, and a lot of small problems out there that within such a large industry continue to affect hundreds and thousands of millions of people. So I don't want us thinking that just because suddenly we've seen widespread adoption of a single new innovation, regardless of how impactful and how important that is, that we can suddenly say, cool, we've checked the innovation box, and now let's just keep doing what we were doing before, but in a slightly different way. We need to continue to have that mindset of growth and improvement and self-reflection and innovation.
Well, let's go there. Let's talk about growth and improvement. Let's talk about the future of healthcare. And you did just mention there are a ton of big problems in this industry. But again, you've worked with some of the brightest minds in this industry. You get to see what's on the cutting edge. You get to be in those trenches and seeing what is and is not working. Taylor, from your perspective, what's the biggest challenge that we are currently facing in the healthcare industry, and why?
I think it's siloed thinking in a lot of ways. It's, healthcare is still, as much as it is a global industry and a global challenge, it's still a very much of a very local and very community and very personal issue and need and industry for everyone. And I think one big challenge that I'm afraid of is that we're going to continue to be in a world where what affects a certain neighborhood in LA or in Denver or in Shreveport, Louisiana, or in Belgium or whatnot, is very unique to that area and very siloed within that area. And only the people that are local, only the people that understand that challenge are the ones that are tasked with creating a new solution from scratch right there in that community. And one thing that we've realized at ScaleHealth is there's real challenges in the LA area that can be addressed starting tomorrow by an amazing innovation in Chicago or in Idaho or in Georgia. And I want to see more of that. I want to see this playing field being leveled in such a way where we don't need to be trapped in our own thinking of, okay, this is the problem that I have. Who do I know that can fix it? And if no one can fix it, then it can't be. If I don't know anyone that can fix it, then it can't be fixed. Because there's, like you said, Mike, there's so many amazing innovators and entrepreneurs out there all around the world that would love nothing more than the opportunity to bring their technology into a small 20, 30 bed hospital in a rural community. And just because they don't necessarily know each other doesn't mean that that's something that can't be done. So that's a lot of what we try to do, is make sure that rural hospital knows about that innovation in Idaho, and those dots can be connected for the patient at the end of the day.
Well, I think what you just shared is the art of the possible, and I believe we can certainly achieve it. We have to continue to work together. We have to get out of our silos. You and I have been talking about that for many years. Matter of fact, we've been working together on that with the Together.Health initiative as well. So been there,
example.
done that. Yeah, we've been there, we've done that. We've been talking about it, bought many T-shirts, right? So we've been definitely at this for quite some time. Rounding it out, I have one more question, and we'll get you out of here. What's that one piece of advice that you have for anybody that wants to innovate within the healthcare industry? That can be an executive that's been in the industry for 20 plus years. It could be a brand new startup. It could be a physician. It could be a patient, anybody. What is that one piece of advice that you have that you would give to help innovate healthcare?
I would give, so I'll give you two answers. One will be a shameless plug, and the other will be more hopefully inspirational and motivational, but I would say the second one first. Uh, don't let don't let the status quo get in the way of a better way of doing things, and don't let it get in the way of your vision. Again, with this dinner that I was able to be at last night, the entrepreneurs around the room saying like all the times they had conversations with executives that were saying that's not going to work. That's not the way that the industry works. If you have a vision for it, and if you see a line of sight into making the industry and the world better, like the world needs that. Like we all need that as humans. We need that way of thinking, and we need that vision. And so don't let don't be deterred by just how hard it is. Like step up to the plate and give it a shot. And the second is like we're here to help. ScaleHealth is here. So if there's anything we can do, like I'm all ears. We're hungry to meet new innovators and new entrepreneurs, and we want our table to continue to grow as much as we possibly can. And we're excited to have all of it, the head of it. And there's never too many good, passionate entrepreneurs that are a part of the ScaleHealth Olive family. So anything we can do to be helpful for innovators is our mission and our goal.
Love it, Taylor, and we're honored to be working alongside you in the community as well. And so, Taylor, thank you so much for taking some time out of your busy day as you continue to build a phenomenal global community of change makers, of innovators that want to push the industry forward. So thank you again for spending time with us today. Taylor McPartland, CEO, ScaleHealth, thank you so much for being with us.
Thank you, sir. Good chatting with you. Appreciate the time.